The baby's organs, such as arms, legs, hair, eyelids, and eyebrows, have formed, and she's about 11.5 centimeters in length. Most pregnant bellies are noticeable by this month. If yours isn't, don't worry, it will be soon enough. In addition to a bigger belly, mom can expect to experience some emotional changes as well. You can also expect to get a look at your developing baby through an ultrasound scan, which may answer some of your most burning questions, such as, is this a boy or a girl? Although reproductive organs have been developed since the first trimester, this month they're big enough for the ultrasound technician to see, allowing him or her to share the news with you if you want to know. With the popular trend of gender reveal parties continuously growing, many parents choose to obtain this information in a way that allows them to be surprised together with friends and family at a celebration. Whether you choose to learn the sex of your little bundle of joy during the ultrasound, this live picture of your baby will give an important look at how she is developing, as well as a defined look at the features of her face, such as lips, nose, eyes, and forehead. The doctor will examine other components of the ultrasound, such as the health of her heartbeat, the stage of baby's development, and the possible presence of major physical defects. The doctor will examine other components of the ultrasound, such as the health of her heartbeat, the stage of baby's development, and the possible presence of major physical defects. Most women enjoy the 4th month of pregnancy, as many of the adverse symptoms of early pregnancy have decreased or subsided altogether. However, such signs as insomnia, dry mouth, nausea, and a light appetite tend to be the last to disappear. Women pregnant with 2 or more babies experience these symptoms more severely during this stage of pregnancy, thanks to the high levels of progesterone and estrogen that are present in these types of pregnancies. Common symptoms of pregnancy during the 4th month include any number of combination of the following: enlarged breasts, pain in back, pelvis, hips, joints, and muscles, breathlessness, which is usually a result of pressure on the diaphragm by the growing uterus, mood swings and persistent irritability, nosebleeds, bleeding gums, dry skin that itches, especially around the growing belly, dry, irritable eyes due to allergies or pregnancy hormones, vulnerability to colds or the flu, gas and flatulence, heartburn and indigestion, weight gain, fatigue, frequent urination, excessive mucus and saliva, dizziness or lightheadedness, varicose veins, facial pigmentation, and finally the development of the alba line, a brownish line that appears from the navel to the bikini line, which disappears shortly after childbirth. Not all the symptoms of pregnancy are uncomfortable. In fact, many women feel great in the 2nd trimester and even begin to feel a questionable sensation along their lower abdomen. This sensation is the beginning of quickening, which feels like fluttering or bubbles across the lower belly. She's now big enough to make an impact that you can feel. As the pregnancy continues and your little one grows, this fluttering will progress into unmistakable kicks, somersaults, and stretches that you'll feel on a regular basis. Once you recognize the fluttering, write down the date and relay this information to your doctor. It'll help him or her determine a more exact due date for your baby. The 2nd trimester often brings another discovery. Your baby is already developing behavioral patterns. Many babies are soothed to sleep by mom's movements throughout the day, which means that when she's ready to rest, baby is ready to wake up and move around. You should be able to detect an average of 4 or more movements per hour when baby's awake. If you detect a sudden decrease in baby's average movements during her hours of wakefulness, contact your healthcare provider immediately, as this is often a signal that she needs immediate medical attention. While baby's in the womb, she may also be yawning, making facial expressions, and thumb sucking, although mom won't be able to feel these subtle movements. Feel free to continue browsing pregnancyhealth.net for more information about the 4th month and 2nd trimester of pregnancy. On behalf of pregnancyhealth.net, thank you for watching.